Hi, I'm Dr. Bill Keck. We've talked about the different personalities involved in these two settings, the academia and public health practice. So now let's talk about how we get these personalities to kind of work together, right? I mean, that's the crux of it. How do we bring folks together? So if you're an academic, what do you need to do to help the practitioner be comfortable working with you? Well, the first thing you have to do, I think, is respect them. I mean, after all, that's not always the case. Sometimes people with those big degrees tend to look down on the people who are out there in the trenches. And believe you me, they know it, they feel it, and you need to get around that. So I think you should focus on ways to make the practitioner feel comfortable in the academic environment. Now that could mean inviting them into the academic setting, to teach maybe, to take part in a class, to bring real-world experienced folks. It may mean giving them access to resources in the academic setting, like a library or meeting space or an auditorium. It can be a whole variety of things like that. Might even mean giving them faculty status if that's appropriate in your institution. All of that will work. In my institution, what we did was form an Office of Public Health Practice, a place that practitioners could come and have official status, but they didn't have to have a special degree or anything like that. But we had meetings then on the campus, so they got used to coming in to see it, and we used it as a way to help them understand how to interact with students and evaluate their work. Right? Now, if you're a practitioner, what do you need to do? Well, you also need to make the academic person feel comfortable in the practice setting. They're probably going to be asking you to put students out there someplace. And if you're going to do that, you'll want to be sure that you're able to interact with that academic person so that you have a sense in what, or a say, I guess would be even better to express, a say in what the students are going to do and what the expectations are for them. You might make it very clear to the academic that you control a lot of data. You have a lot of information about the community you live in. So under the right circumstances, that data could be made available to the academic person for them to pursue their desire to do research. You may even want to hire them. After all, a lot of local health departments now have to do community health assessments. And not everyone has the skill to do that well. You might, if you have a little cash lying around for something like that, you might hire them to actually do the community health assessment for or with you. And even in some cases, if you don't have cash, they might be willing to help out. So those are some of the things you can do to help this interaction occur.